So I'm going to be doing my subcutaneous injection validation video. First, I'm just going to scan the room, show that there's nothing hanging on the walls, anything. Also, just to scan at my MAR, that there is no writing on it. It's completely printed as normal. So here we have Joanne Peterson, 12-10-47. She has no known allergies. She's a high fall risk, and she's a full code. She was admitted because of diagnosis of dehydration and falls. She lives alone, so that's also contributing to her high fall risk. She takes furosemide 20 milligrams PO daily and an albuterol inhaler as needed, 2 puffs for shortness of breath. I'm looking at her vitals here and they all look good. Stable, heart rate of 76, BP's 128/72, respiratory rate of 20, SpO2 of 98%. She's alert and oriented, just resting in bed because she ambulates with assistance. And I just see here that she has a standing or a now order due for heparin, 5,000 units per 1 milliliter. So I'm just going to go in and talk to her real quick and make sure she has an understanding of the medication, and then I will do my first med check. Knock, knock. Hi, Joanne. My name's Samantha. I'm going to be your student nurse today. Can I just get 2 patient identifiers, your name and date of birth?
Joanne Peterson, 12-10-47.
Awesome. So now I've performed some hand hygiene. So I saw you have a standing order for a dose of heparin. I just wanted to give you some education on heparin, make sure you understood it, and make sure you consent before I go draw that up for you. Basically, so you're getting heparin or you have an order just because you are bedridden. Mostly you have some movement and ambulation, but with that, it can increase your risk for some blood clots in your legs or stuff like that. So if we give you heparin, that's a blood thinner, and basically what that's going to do, it's going to thin your blood out, and make it less of a high risk for you to get these blood clots in your legs or so other places. With that, there are some risks. It does increase your risk for bleeding, and bleeding can look like it's abnormal. It's not just like a little bit. It's going to be like if you're brushing your teeth and you notice your gums are bleeding more than normal, if you scratch your skin and all of a sudden it's bleeding abnormally, or if we're monitoring your eyes or your input and output with your stools, it could be black tarry stools. So all things that are going to be abnormal and are noticeable, but we will be monitoring your dosing and stuff like that. So that's not more than likely won't happen, but I do just have to inform you of the risks. So with that in mind, do you have any questions or do you consent to this medication?
I do.
You consent?
Oh, yes, I have no questions.
Okay, awesome. So I'm just going to make sure you're in a comfortable position.
Yes.
And you are high fall risk, so your collate is in place. I'm just going to go drop that medication now. First, I'm just going to grab some gloves. So now I'm back in the med room. I'm going to do my first medication check here before I do any drawing up. So I have some heparin, and I have Joanne Peterson. My medication is heparin, 5,000 units per 1 milliliter. 5,000 units per 1 milliliter. Route is subcutaneously. This is subcutaneous injection. Reason why, or her indication, she's immobile mostly, so we just want to prevent any blood clots and stuff like that, and that's what heparin, it's a blood thinner, it'll prevent that. And her vitals are all good, and she doesn't have any appeared bleeding or any wounds noted. I will just check before injection to make sure, because I don't want to give this to her if she has an active bleed anywhere. But none of that was apparent. So I did my first medication check, and now I'm going to draw it up, and then I will do my second. So I just have a 3 milliliter syringe. We're just drawing up 1 milliliter, so that'll be fine. And then I also have a 25 gauge 5/8 inch needle. We do need a shorter needle than we would for IM, just because this is only going into the subcutaneous layer of the skin. We don't need a complete 1-inch one because it's not going into the muscle. We don't want that with that. So, and it's just a smaller gauge also as well for subcutaneous injections. So first, I'm going to use a blunt tip, and I'm just going to get that open, but I'm not going to let it touch anything, keeping it sterile. And then I'm also just going to have my syringe open so I can make it easier. And then I'm going to, this is a multi-use vial, it's not sterile, so we're just going to scrub it for 15 seconds, then I'm going to let it dry with alcohol. Okay, so while that's drying, I'm going to take my syringe and I'm going to connect my blunt end to draw up my medication. And then also, so now I'm also drawing up 1 milliliter. So I'm going to drop 1 milliliter of air into my syringe. Okay, and then that's dry now. I'm going to inject my air into my vial. Okay, so now 1 milliliter of heparin will be drawn up. I'm just going to draw it up a little bit past so I can get rid of some of those air bubbles. I'm just going to try and get rid of some of those air bubbles. Just flick them out, and then I'll confirm my dosing with the camera here. Okay, all my air bubbles are out, and I have 1 milliliter of heparin in my syringe. And I'm just going to one-handedly cap that back on without touching it on anything. Still good. And then I'm going to open up my 25 gauge subcutaneous needle and making sure nothing touches that. That's staying sterile. I'm going to take off my blunt end tip. Okay. So I have 1 milliliter of 5,000 per 1 milliliter heparin in my syringe, and now I'm going to do my second med check while I write up this tape, just because I am transferring into the patient's room. I don't want to get it mixed up with anything. So for my patient here, comparing, I have Joanne Peterson on her mark, Joanne Peterson. So we have that. And then our route, this is a subcutaneous injection. We have our dosing, 5,000 milliliter, 5,000 units per 1 milliliter injection, 1 milliliter. And then I also have a standing order. It's now our indication just for some prophylaxis of blood clots. And then I will document after I administer this. So, now that I've run through my second med check and patient rights, she's been educated, I'm going to go in and just prep for the administration. I'm going to grab an alcohol pad, I need my MAR, and I need my medication to confirm when I get in. Okay, so this will go in the patient's room. Change my gloves. Knock, knock. Hi, Joanne. I'm back. Samantha, your nursing student, and I'm just here to give you your heparin injection. Can I get your date of birth and your birthday, or your date of birth and your name? Sorry.
Joanne Peterson, 12/10/47.
Awesome. How are you feeling about this? You feeling nervous about your injection or anything, or are you feeling okay?
Is it gonna hurt?
It might feel some slight stinging or pinching. I just wanted to inform you this is a subcutaneous injection, so I have a few different spots we could do it. We could do it on the outside, like the lateral part of your arm. You could do it in the outside of your thigh, any fatty tissue area, or in your abdomen. Is there any one you specifically would prefer?
My abdomen.
Okay, so I'm just gonna make sure there is privacy, and I'm just gonna only expose what's required to give your injection here, keeping you covered. So I'm just gonna make sure I'm 2 inches away from her belly button when I'm doing this. And now I'm going to do my third med check before I prep her skin so it stays sterile. That was caught, did not hit the ground. So I have Joanne Peterson here. I have Joanne Peterson here. We have 5,000 units per 1 milliliter of heparin. Subcutaneous dosing now. Indication prophylaxis of blood clots, and all her vitals are good. She has no apparent bleeds or anything on her skin from what I can see, or that was noted in her head to toe. I'm just going to remove this tape so you can see that now better. We've completed our third med check, and now I'm just going to sanitize her skin with an alcohol prep. I'm just going to go in a circle here. And we're going to let that dry. And then with subcutaneous, I'm going to be injecting it at a 45-degree angle, not 90-degree, because we just want to go right into the skin. We don't want to go straight into the muscle. And I'm also going to pull the skin taut, not a Z-track. So, and I'm going to make sure the bolus of the needle is up. So I'm going to remove my safety tip, and then I'm going to pull the skin taut. I'm going to go in at a 45-degree angle, just right under the skin, but not into the muscle. And we're just going to inject at a nice, slow, steady rate. I'm going to pull the skin taut. If there's any bleeding, I would give her a Band-Aid. Doesn't appear to be any, but I'm going to recap with the safety device on the needle, and then I'm going to dispose of that. I'm going to perform some hand hygiene, and I'm going to cover you back up. How are you feeling?
I feel okay.
Good. Didn't hurt too bad?
No, not bad at all.
Great. You did great. I'm just going to pick up some of my garbage. All the sharps have been disposed of in the sharps container. So just gonna throw that in the garbage. I should do more hand hygiene after that. Okay, so I'm just gonna be back to check on you in about 15 minutes. I'll make sure you're still feeling good and everything. Does that sound good? Do you need anything else?
It sounds okay. I don't need anything.
Okay, awesome. So I'm just gonna take my Mara with me and everything. She's in a safe position. And now I'm going to document that I gave 5,000 units per 1 milliliter of heparin subcutaneously into her abdomen. And yeah, so now I'm gonna go back. It's been about 15 minutes. Knock, knock. Hi, Joanne. It's Samantha, your nursing student. Can I get your name and date of birth again?
Joanne Peterson, 10/12/47.
Awesome. I'm just gonna look at your injection site here just to make sure you didn't have any bruising or swelling, any redness. Everything looks good.
Okay.
Awesome. So you're still feeling okay, and any dizziness, or you don't feel lightheaded or anxious or anything?
No, I feel okay.
Awesome, and there was no abnormal bleeding noted, so everything appears to be good. It's been documented, and she's in a safe, comfortable position. Her call light is in reach, and yeah. Anything else?
Nope, I'm okay.
Awesome. Okay, I think that's the end.